Well, migraines have certain characteristics that we look for. Usually they occur frequently, usually 2 or 3 times a week. They're intense. They tend to be pounding headaches. They are usually on one side of the head, and they usually have a long history. Most of the time when a migraine patient gets to us, they've already seen 5 or 6 migraine doctors. They've already had a pretty extensive workup, usually including a brain scan to rule out any kind of internal pathology. They've tried multiple rounds of medications and preventive measures. They've had various kinds of therapy. And so we try to review that history and not repeat it, but take it from there. In the world of migraine headaches, usually a careful history and physical examination is key, and review of imaging is key. We look for clues, what's been tried before, what's worked, what hasn't worked. If some medications are working, then we continue those and possibly add on additional medications. If medications have not been tried, or one class of medications has not been tried, we'll try those. Progressing from that, if the patient continues to show little or no benefit with medications, the next thing we try is various nerve blocks. Nerve blocks are not a major surgery. They're outpatient. We usually do them with a little sedation, usually under fluoroscopic guidance. And the nerves that we're usually talking about blocking are the occipital nerves, which are the main nerves that go to the top of the head and the scalp, where most headaches are perceived. And then the nerves that contribute to those occipital nerves, which leave the spine and the upper cervical joints. In the world of migraines, in the world of all headaches, many patients report various triggers like loud noises, bright lights, stress, anxiety. Sometimes various foods or medications can trigger migraines. So if you can find out what are the triggers for that patient, you can go a long way towards treating the patient. Treatments have advanced over the last decade or two, in that for the patients that don't benefit from the various classes of medications that are available, we can do nerve blocks, which were very uncommon 10 or 20 years ago. Also, a new therapy that we're using now is Botox. In treating chronic migraines, initially we'll see the patient every 2 weeks if we need to, and then every month. And once we get them stabilized on a successful treatment regimen, we may see them every 2 or 3 months. So it's important for migraine sufferers to realize that you don't have to suffer. If your medication is not helping you control your migraine headaches, come to us. We may have the answer for you.